Hi, Jordan. I'm Dr. Squires. Nice to see you. I see you're here for a follow-up today. Is that right? Okay, so I took a look at your vital signs and noticed that you have lost 20 pounds since you were here 3 months ago last time. That is amazing. Did you change your diet or did you start exercising like we had talked about? Great. Well, you've obviously done a great job. Keep it up. Now, I did want to tell you and discuss with you today your lab work. And unfortunately, the level of what we call the bad cholesterol, those levels are not where I want them to be. Yes, they are a little bit. They're better than last time. However, we really need them to be lower than they are to reduce your risk of a stroke, for example, or cardiovascular issues, heart problems. That's what we want to focus on to get to get those levels at a good level, low enough to where we're less worried about you having heart problems or a stroke, which would not be good. Well, I don't want you to be discouraged. I think it's great, that you've lost all this weight and you're watching your diet. I want you to keep doing that. This is very good. But we may be at a time now where we need to look at, I would like to prescribe a medication called Crestor. It's a statin drug. There's many different drugs, but the one I like to prescribe is called Crestor. Yeah, so those are called statin medications. What those medications do, they're for people like you with higher levels of the bad cholesterol, the bad fat, if you will. And what they do is essentially they kind of act like a cleaner. They keep the bad fat from forming and sticking to your bad artery, to your arteries. No, actually, they're not new. They've been around for a long time. I prescribe them almost every day. They're very common drugs. A lot of people take them, and they get great results. Like I said, we just want to prevent a stroke or bad heart problems, heart disease even, from happening. And these medications, like I said, they've been around for many, many years, about 20, 30 plus years really. And they're cheap, which is always great. Well, I understand that taking a pill is not always, nobody wants to do that. I don't want the patients to be taking a pill, especially when you've done all this work, with the diet and the exercise. But, I understand taking a pill is not always, nobody wants to do that every day, but you have to understand that the bad fat, the bad cholesterol, kind of works in a way that it clogs your artery little by little and can cause a stroke. I kind of want you to think of like a sewer, like a drain pipe, like in your house, and if somebody was pushing shortening down in it every single day, never cleaning it, eventually it would become clogged. So that's what's going on, when you have cholesterol in your body. It's kind of what goes on, and eventually those arteries become clogs, the blood can't go through, and that's when we run into problems. Those medications kind of help, that formation of what we call plaque or blockage from happening. Does that make sense? So that's a really good question. I think we can start with a 90-day trial, about 3 months. Keep up the diet and exercise. We will redraw your labs in about 90 days to see where you're at, If it's not better after 90 days, we may need to adjust the dose, make it a little bit higher. Those come in 5 and 10 milligrams, so we can, look at adjusting the dose. Keep in mind that some people are on this medication for a long time, sometimes their whole life. But it's better to take a pill every day and manage that condition than, you know, ending up dead prematurely with a stroke. Well, you know, it's a great idea to completely eliminate alcohol. Alcohol is not good for us, even if we're healthy, really. But, you know, I don't think once in a while it'll hurt you. Especially since you've been keeping a healthy diet and been exercising. What type of exercising are you doing, by the way? I think that's wonderful. I think all those minor changes, you know, will really add up over time, and hopefully, you know, the medication will be a short-term thing, and really you'll feel the effects of, you know, the improvements is what we want to see. If you don't have any more questions for me, you can check out at the front desk. We can make sure we have your correct pharmacy on file, and schedule an appointment in about 90 days, and we can see where we're at, okay? Thank you and have a great day.